Thank you for joining us on this training for the Crisis System of Care. My name is Wendy, and I'm the project coordinator for the Early Diversion Program at Southwest District Health.
And I'm Cass, the project manager for the crisis centers in Idaho's Region 3, serving Adams, Washington, Payette, Gem, Canyon, and Owyhee County. During this presentation, you will learn about the crisis system of care in Southwest Idaho and how to navigate it. So let's get started. Firstly, thinking about your current process for helping individuals during a crisis, whether at work or in your personal life, what do you do? For example, for a child or teenager in crisis, where neither home nor a hospital are the best place to de escalate the crisis, do you know how to help? What about an adult in your life who needs immediate support from a mental health professional? Do you know where to direct them? By the end of this training, it is our hope that you will be able to confidently answer these questions and have the tools you need to support anyone in crisis. We're obviously going to be talking a lot about crisis throughout this presentation, so let's define crisis before moving on. Crises can look different for everyone and often varies by age. A crisis for a young child will probably look different than a teenager, which will probably look different than an adult. In Idaho's crisis system, crisis is defined and determined by the individual and or family that's in crisis. Oftentimes, we think of a crisis as thoughts of suicide or an active suicide plan, but not all crises are that acute. We encourage people to not only expand their current idea of what a crisis looks like, but also to understand that the crisis system can be accessed for any level of crisis from 1 to 10, including crises related to challenges navigating mental health conditions, abuse, neglect, grief, social issues, substance use, and even challenges related to basic living needs. The crisis system has three main purposes. The first is to divert people from unnecessary involvement in the justice system and admissions to emergency departments, hospital stays, and even potentially sometimes unnecessary inpatient stays for behavioral health crises. Crisis services are specifically designed to support behavioral health crises. They're low barrier resources intended to get people to not only the right place, but also at the right time for their needs. Getting support from crisis system providers can also help to prevent future crises, like substance use, self harm, harm to others, suicide, and overdose. And while the crisis system isn't necessarily in the outcomes business, because we don't always get the opportunity to follow clients throughout their healing journey, these services can help instill resilience and self-sufficiency skills to promote well-being. So before diving in to talk more about the specific services in the crisis system of care, let's talk about how the system is managed. So previous to 2024, the crisis system was fairly segmented and managed differently between different organizations. The system is now managed under one organization, which is Magellan. Magellan is Idaho's behavioral health managed care organization, funded by the Idaho Department of Health and Welfare. While the crisis system providers do vary by pillar and location, the overall system is now under one umbrella for better coordination of services across the state and between the different types of services that we provide. The system is modeled after national best practices, but the goal is to continue to improve the system to best meet the needs of Idahoans. All services in the crisis system are free and available to everyone everywhere in Idaho. While portions of this presentation are specific to Southwest Idaho, anyone in Idaho can access free crisis support. There is no limit on usage, and kind of like the 911 system, which Wendy will be discussing further, we are in the business of providing care, whether help is needed just once or even dozens of times. Something to note, however, is that legal guardian consent to receive any crisis services in non-life threatening situations is required for youth under the age of 18 due to Idaho's Code Section 16-2422. Now that we have a foundational knowledge of the crisis system and understand its purpose and background, let's actually dive into the services. The crisis system has three pillars of care: someone to talk to, someone to respond, and somewhere to be. I'm going to pass it over to Wendy to talk about the first pillar of care, 988.
Thank you, Cass. The first pillar of the crisis system of care is someone to talk to. That number nationwide is 988. We've all been trained to call 911 during an emergency. Well, now there's a 3-digit number, 988, that you or a loved one can call when experiencing a mental or behavioral health crisis. Like 911, it is free and can be reached 24 hours a day. The challenge can be deciding when to call 911 and when to call 988 during an emergency. 911 should always be called when there is a medical emergency, such as a heart attack. 988 should be called when someone is in crisis due to a mental or behavioral health issue, such as substance use disorder, suicidal ideation, or other situations that could benefit from de-escalation assistance. When you call 988, the crisis phone responder can determine if or when law enforcement needs to be involved. You can be confident in knowing that 988 crisis responders will make sure that the correct people will be involved in any crisis situation. 988 is a number that, in Idaho, is operated by the Idaho Crisis and Suicide Hotline. The 3-digit 988 number went live in 2022 as a universal mental health and suicide prevention crisis number, replacing what was a 10-digit number. This is a free supportive services 24 hours a day, 7 days a week for anyone experiencing a crisis or someone that has a friend or a loved one experiencing a crisis. The phone responders are highly trained and prepared to provide crisis de-escalation, safety planning, resources, or help getting higher levels of care to address the needs of the caller. It's important to understand what happens when someone calls 988. When a person reaches out to 988 on the phone, the caller will hear a pre-recorded message with selection options. If the caller chooses one of the options, they will be transferred out of Idaho to a national support line. Staying on the line will allow the caller to speak to the Idaho Crisis and Suicide Hotline, the local 988, and crisis responders. There may be a short hold with music while you wait to be connected to a crisis phone responder. The crisis responder will answer, introduce themselves, and then ask about the caller's safety. Once the caller's safety is confirmed, the crisis responder will ask the caller to tell them what's going on. They'll listen, they'll ask questions, and they'll provide support and help to create a safety plan. If you are taking this training and you've not called 988, but think you might be encouraging others to reach out for help, it is recommended that you call 988 yourself. When you call 988, let them know you're not in crisis, but would like to know more about 988 so that you can speak from your own experience and share that with the person you are helping to support. 988 is available in English, Spanish, American Sign Language, and through TTY, a telecommunication device for the deaf. You can also text the number 988 to communicate with a crisis responder, and you can chat with someone online at chat.988lifeline.org. As explained earlier, 988 is subject to the guardian consent law, which requires anyone supporting a youth in a non-emergency situation to receive guardian consent for that treatment. To be clear, a youth can call, text, or chat with 988 at any time. When they reach out, a crisis responder will talk with the youth to determine if it is an emergency situation, and suicidal ideation is considered to be an emergency situation. If the responder decides it is an emergency, they can continue to help the caller. If the crisis responder decides, in agreement with the youth, that the situation is not an emergency and the caller or texter is not suicidal, then the crisis responder must get legal guardian consent to continue the call or text. If you have questions regarding 988 and the guardian consent law, this slide includes an email for Lee Flynn, the director of 988, and she will be happy to answer your questions. One last point about 988 before we move on. Most crises can be resolved using 988. 85% of calls or texts are de-escalated. For those that cannot be de-escalated over the phone or through text, 13% receive support through mobile response teams or crisis centers, and only 2% of calls to 988 involve law enforcement and EMS. The second pillar of the crisis system of care is someone to respond. In Idaho, that pillar is the mobile response team. During a call to 988, the crisis responder may decide that the best way to support the person in crisis is to dispatch a mobile response team to meet the person where they're at or where the person is comfortable meeting. Mobile response teams can come to the caller's home, school, or any other public location and provide free in-person support. There are two organizations that provide mobile response throughout Idaho: Community Bridges and Benchmark. Currently, they can be dispatched by 988 from 8 a.m. to 11 p.m. every day. Starting in July, the mobile response teams will be able to be dispatched 24 hours a day, 7 days a week. Average response times can vary by location, but in Region 3, the average is 56 minutes from dispatch to arrival at the location, but can be longer if you're in a remote or rural area. Mobile response spends on average 93 minutes with the person in crisis to help de-escalate the situation and create a safety plan. The mobile response teams are always staffed by 2 behavioral health professionals. They work closely with law enforcement and can involve first responders when appropriate. While visiting with the person in crisis, the mobile response team may decide that a higher level of care might be needed to help stabilize the crisis. They will discuss options with the person and decide together where the most appropriate next level of care might be. When they come to an agreement, the mobile response team can then transfer the person to a location such as a crisis center, hospital, emergency department for ongoing support. It is important to remember that both 988 and the mobile response teams are available to anyone, anywhere in Idaho. They're free and don't require any health insurance to access. Now I'll pass it over to Cass to provide you with information about the crisis centers and the vital role they play in crisis support and stabilization.
Thanks, Wendy. In Region 3 of Southwest Idaho, there are 2 crisis centers. The first is the Western Idaho Community Crisis Center in Caldwell, which opened in spring of 2019. And the second is the Western Idaho Youth Support Center, which opened in a temporary location in January 2024, and then transitioned to our new location in February of 2025. If you're not sure how to find us or reach us, let's pause on this slide before moving on. You can take a screenshot, write down the information, take in the information, and then we will move on. Okay, feel free to go back and pause if you need more time on that slide. The 2 crisis centers have many differences and similarities. Firstly, the Western Idaho Community Crisis Center serves adults ages 18 and older, while the Western Idaho Youth Support Center serves youth from ages 5 to 17. But remember, we've said this, a few times throughout this presentation, that legal guardian consent is required before we can admit youth for services. In the case where legal guardian consent is difficult to be obtained or can't be obtained, the center typically will work with law enforcement and/or the Department of Health and Welfare to identify how to best support the youth. The other biggest difference between the 2 centers is that the Western Idaho Community Crisis Center may be able to offer transportation to and from the center if the individual doesn't have transportation access. If someone needs help getting to the Adult Crisis Center, they can call at 208-402-1044, or they can call 988 to get that support from a mobile response team who can get them to a crisis center if they still need it after mobile response team intervention. Unfortunately, the Youth Crisis Center does not have capacity or ability to provide transportation, so we do encourage individuals and families with transportation needs and are experiencing crisis to utilize mobile response team support and request a ride to a crisis center if needed. Both centers have plenty of beds for sleep and rest, with 20 beds in the adult center and 9 beds in the youth, with separation between gender and, in the case of the youth center, age and ability level even. Even though there are few differences, the centers offer essentially the same service and quality of care. Individuals can stay at the centers for up to 23 hours and 59 minutes in a single episode of care, with direct readmission available for those who need it. For example, clients might still need support working through their crisis. Maybe they're waiting for a bed at another facility to open up, or a guardian needs more time to be able to pick up their child. Our support staff include a safety team who monitors the front desk, EMT basics, clinicians, case managers, and peer support specialists who are all crisis prevention intervention trained so that no matter who a person interacts with, they are in good hands with people who care about their needs and know how to support them. Our free services include behavioral health and medical assessments, crisis de escalation, of course, food, clothing, laundry, personal care items, safety planning, and non medical detox, as well as connections to care after their stay. It's important to remember that crisis services, including crisis centers, are voluntary. The individuals who come to crisis centers need to want to be there and are willing to abide by our code of conduct, which means they cannot be violent or threatening to staff or other clients. Crisis centers, in particular, must be a safe space for everyone. A different level of care might be required if highly elevated individuals cannot be de escalated through verbal means, since crisis centers in Southwest Idaho do not do mental health holds or use any sort of physical restraints. Additionally, clients must be medically stable. If they're not, the individual will be transitioned to one of our great health system partners to be cleared and to get back to the center again if appropriate. And while the centers are ADA compliant and accessible, clients must be ambulatory, meaning they must be able to get in and out of bed on their own, be able to use the restroom showers on their own, etc. The final eligibility criteria is that they must be coherent enough really to get through the intake process and be appropriate for non medical detox. Since we only staff EMT basics who can manage basic medical needs and work through medical emergencies, we don't have a pharmacy for medications. So, someone with medication required detox will be supported to get to a different level of care. Even though there are some eligibility requirements due to capacity, we do not require an appointment, referrals, or insurance to receive services. Anyone can walk in anytime and they don't even have to call 988 first. We know that crises can't be scheduled during normal business hours. That's why we're always open and always free. And while we do serve counties, people living in counties in Region 3, again, that's Adams, Washington, Payette, Gem, Canyon, and Owyhee counties, we will not turn away people from any other area, even if they come from out of state. Since the Western Idaho Youth Support Center recently opened in their new location, we thought we'd show you a couple pictures of our new space. Here you see our new recreational common area and one of 3 pods for sleep and rest. We also have a place for them to eat. We have quiet and sensory rooms, assessment and intake rooms, a private entrance for first responder drop-offs, and then of course offices for all the staff. If you'd like to see the space in person, including the Adult Crisis Center as well, please reach out to me. But now I'm going to pass it along to Wendy to tie all this information together and conclude our presentation.
Thanks, Cass. We hope that this training has been informative and that you now have a better understanding of how to help during a behavioral health crisis. The 3 pillars of the crisis system of care, from texting or calling 988 to mobile response teams and to the crisis centers, are all here to support anyone, anywhere in Idaho experiencing a crisis due to mental or behavioral health issues, substance use disorder, suicidal ideation, or other situations that could benefit from de-escalation assistance. It's important to understand that there is no wrong door to enter the crisis system of care. You can enter directly through 988 or straight through the crisis centers. The crisis system of care is here to help make sure that our families, our friends, and our communities have the support that they need during a crisis, and also help to prevent future crises, substance abuse, self-harm, harm to others, suicide, and overdose, while also helping to promote well-being, resilience, and self-sufficiency. So thank you again for your time. If you have any follow-up questions or would like an in-person training or informational materials like brochures or flyers, please reach out to us at the emails listed on this slide.